You hear me talk about bad filler aging people faster. Well, bad surgery can do the same thing as well. And Archer is an excellent example of that. At 61 years old, a prior facelift left her with some contour irregularities along her jawline, aging her faster. But most noticeable, without question, is Archer's upper eyelids, which are very hollowed out after a prior eyelid surgery took all the fat out of her upper eyelid. I found this out the hard way. When I was doing Archer's upper eyelid revision, I realized that the prior surgeon had taken almost all of the fat out of her upper lids. All I was finding was little stumps or remnants of those prior fat pads. Normally I can take those fat pads, rearrange them, and move them to create volume in her upper lid, but I had to get a little bit more creative with Archer in her particular situation. And you can see we did a beautiful job restoring the volume to her upper lids, bringing the life back to them. I utilized my own proprietary technique where I borrowed fascia that I took from her temple during her brow lift, and I used it to volumize her upper eyelid, also using her own fat transfer to do that. So rearranging the fat pads, borrowing fascia, and transferring fat. That's also how I was able to correct her jawline. Archer had also had a prior upper lip lift and a lot of filler in her upper lip. I was able to restore and correct that, also doing a very unique procedure to restore her philtral columns, the two vertical columns in her lip. And for Archer's cheeks and lower eyelids, most of what I found here when I went in to do her revision was filler related. After 15 years of filler quite literally adding up for her, I removed that filler manually from those areas, elevated the fat pads in that area back where they wanted to be, and this is the result that we get afterwards.